Dr. Sylvia Frazier Bowers and I would like to thank the American Association of Orthodontics Foundation for supporting our research project entitled Efficacy and Acceptability of Antiseptic Mouth Rinses on Salivary SARS-CoV-2 Infectivity. There's ample preliminary data from benchtop experiments showing that oral rinses can inactivate envelope viruses like SARS-CoV-2, the virus that causes COVID-19. But human mouths do not act like petri dishes. At this time, there are few human clinical trials that are designed to appropriately test the efficacy of mouth rinses against SARS-CoV-2. As a result, we're testing commercially available, FDA-approved oral rinses in a randomized controlled trial with patients recently infected with the virus. We will have COVID-19 positive patients give a saliva sample immediately before and right after an oral rinse and at 15-minute intervals thereafter. We can then measure the saliva's viral load, or the amount of virus, the amount of viral replication, and salivary infectivity. For the infectivity assay, we can test how infectious the saliva is with human cells, which is a great indication of whether saliva is capable of spreading the virus. We will also ask participants whether they would be willing to use such an oral rinse in healthcare and social settings to evaluate acceptability. We're hoping to find an acceptable oral rinse that reduces viral load, replication, and salivary infectivity for at least 30 minutes, the time of a brief social interaction or healthcare visit. If we find a mouth rinse capable of inactivating SARS-CoV-2, people could rinse briefly before many situations where masks need to come off or where people are in close quarters with one another to decrease the potential for transmission. This would be particularly useful in dental and orthodontic contexts where we work in patients' mouths and see a larger volume of patients. Though infection rates are dropping and vaccinations are occurring at a rapid pace, vaccine hesitancy continues, along with the emergence of new variants, making it important for us to identify FDA-approved active ingredients capable of preventing transmission. An oral rinse is also antigen blind, so it would work against all SARS-CoV-2 variants and likely other envelope viruses like herpes and influenza. Many dental offices are already using such a pre-procedural mouth rinse, but we need good data to choose which rinse is most effective against SARS-CoV-2 and for how long it's effective. An antiviral oral rinse could become part of standard of care in dentistry and healthcare, and we hope this project can help us identify an effective and acceptable oral rinse to prevent transmission of COVID-19 and other enveloped viruses. Thank you, AAOF, for your support.